Welcome everyone, welcome back to Urgent Care Stories. Today's episode is another interesting case that was the only one of these that I've ever seen. We'll start it off and just get right into it for you. This was a woman who was in her early 20s. I think she was maybe 22, 23, something in that realm. No medical history at all. And she was a nurse working in a local emergency department. And she only took oral birth control was the only medication that she's on. She has no allergies to anything. Her chief complaint is achy bone pain in both thighs. The story goes she developed the pain suddenly about maybe 1 or 2 weeks ago. The pain has progressively been getting worse day after day. It's described as a deep in the bone achy pain. It's all the time. Nothing relieves the pain. She went to her local emergency department for this complaint, and I think they did some x-rays of the thighs and everything was clear. So she comes to my urgent care to be further evaluated for this issue. So when somebody comes in thigh pain, in a younger person, you're not thinking vascular claudication, basically lack of arterial blood flow to the legs, but that would be a consideration. In the older population, you'd be thinking tumors, masses, fractures, musculoskeletal pain. Could she have rhabdomyolysis from strenuous activity? Could it be an electrolyte abnormality or a deficiency in something, a dehydration? Could it be an infectious etiology? Could it be a nerve-related radicular type issue in the thighs? Those are all the things I kind of initially am thinking of with that chief complaint. We start asking questions, fevers, chills, radiating pain, back pain. Has she been on any new medications recently? Has she had any trauma to the area? All of that workup and questioning is negative. So then we get to our physical exam. We palpate her back. She has no tenderness to the spine. We rotate her hips. No pain in either of the hips. I mash on her quad muscles. I push on her IT bands. I cannot reproduce any of this pain. She doesn't have any edema, no swelling to both of the lower extremities, so it doesn't really look like a blood clot. So at this point, I'm thinking this is very weird. I can't explain why she's having her symptoms, and her physical exam does not support anything because there's absolutely no findings. She's already had imaging done of the area, so I don't feel the need to get another set of x-rays on this woman. My initial workup, I decided to do some blood work and a urine sample. I got the urine because I wanted to look for signs of rhabdomyolysis. So basically you have something that causes a lot of muscle breakdown in the area, and you get a lot of myoglobin, and in the urinalysis, myoglobin will be positive for blood. So you'll have blood in the urine, but in this case, you're looking for blood because it's not detectable as myoglobin, it's only detectable as blood. The test doesn't know the difference. Her urine is clean, no blood in the urine. Her pregnancy testing is negative for those who have seen that episode. We get a metabolic panel to check her kidney function. Kidney function's perfect, electrolytes are all within normal range. I also got a CBC, a complete blood count, just to check. On her complete blood count, her white blood cell count was, I want to say 26 or 28,000, significantly elevated. Now, there's several reasons you can see an elevated white count. Most commonly, you're going to see leukocytosis in infectious etiologies. Pyelo usually causes a pretty high white count in the 20,000s. Most of your kind of standard intra-abdominal abscesses, stuff like that, are going to raise it into the teens. You're not typically going to see a lot of 20,000+ white counts on a regular basis. Another reason you can have an elevation is steroids. So prednisone use can cause an elevation in the white count. Pregnancy can cause a slight increase in white count, 2,000 to 4,000. Steroids, about 4,000 increase. Leukemias, any sort of a white blood cell cancer can also cause an elevation in the white count. So at this point, we've had negative x-rays, imaging to the thighs. We have pain in the thighs that we cannot reproduce on exam. She has no history to suggest a musculoskeletal issue or a bony issue. We know that her electrolytes are fine. She doesn't have findings to suggest a deep vein thrombosis. And if I remember correctly, I think the emergency department already did an ultrasound of both legs and ruled out a thrombus. So we know that the legs themselves are good in the sense that there's nothing intrinsically wrong with them that we can detect. The white count is not explainable, though. At this point, I kind of decide that this woman needs more care than I can just provide at my urgent care, and I decided to send her back to the emergency department. When I send her back to the emergency department, I tell her that she needs to be admitted and they need to do a bone marrow aspiration to look for leukemia. That's kind of my biggest concern, is the elevated white count as high as it is with the achy bone pain. Could this be leukemia and she's having pain in the bones, like in the medullary canals of the femurs, that is causing these symptoms for her? The last thing I tell this woman before she leaves is be your own advocate. I say, look, you know, a lot of times in the medical world, we can brush off things if we can't explain what it is after we've done an initial workup. And there's a time and place for that. There's certain complaints that people come in with that are just kind of self-limited, or they're benign, or it's a lot more to do with lifestyle or lack of activity. You know, there's nothing serious or critically medical going on, and so we kind of just brush it off. But one lesson that I was told by one of my attendings who taught me a lot was, if somebody comes back into your clinic for the same complaint and you already did some degree of an initial workup and you didn't find an answer, you need to work them up further. So in the sense that somebody comes in and you didn't do any blood work, you need to do blood work. If you didn't get imaging, you need to get imaging. And so that's why I ended up doing the blood work on this woman for this complaint. And I'm glad that we did, because it found this elevated white count. Now, she went to the emergency department and they admitted her, and they did bone marrow aspirations. Luckily, she was negative for leukemia. Her blood counts all looked good, other than the white count. They couldn't explain that. They did CTs, MRIs. They did it of her thighs, of her brain, of her back. They did all of this testing. She was admitted for several days, and they couldn't find anything wrong with her. Finally, they get to kind of like being admitted for 5 days, no change in symptoms at all, and they're about to let her go. They're about to discharge her because they say, look, we've done everything that we can. We cannot explain why you're having this happen. We don't understand this. She says, no, please, like, is there anything else you can do? Anything you can think of? Like, I feel like something's wrong. I need to have, you know, an answer here. I need to have a diagnosis. Thankfully, whoever the provider who was caring for her at that time, they decided to order some sort of an advanced imaging with contrast of the brain. So I don't know if it was a CT with contrast or an MR with contrast of the brain, but what they found was that she had a venous thrombus, a blood clot in her brain. Now, in the leg, it's called a deep vein thrombosis, but in the brain, it's called a cerebral venous sinus thrombus. I have never seen another one of those previously. And the symptoms are kind of vague, but basically the pathology, what was going on was that it was increasing swelling or increasing pressure by that backflow of venous runoff from the brain in the area where her brain innervated sensation to both thighs. So this presented as deep aching thigh pain because of the compression on that area of the brain. Now, the white count is what I cannot explain. That wouldn't explain it unless this is just an inflammatory response from the swelling and from the blood clotting in the brain. They chalked it up to this was because of her oral birth control, and so they got her off of the oral birth controls. Again, birth controls with estrogen increase the risk of clotting. That's a known risk of that drug. And they put her on anticoagulation. They put her on Eliquis. And within a few weeks, her symptoms had all resolved, and the white count resolved as well. So that was just a very interesting presentation. The lesson from a provider perspective is, like I said, if you have not figured out what's going on, you need to increase your workup. You need to do more to try to figure that out for the patient. And from the patient perspective, it's being your own advocate, making sure that you're fighting for yourself. If you're really concerned, if you feel like something is wrong, you need to have the provider that you're working with do the workup that you need. And if everything's been done and you still don't have a diagnosis, then you know, that gets to a tricky situation, and it kind of is just dependent on the situation and the symptoms and what's going on. But you need to be your own advocate. You need to fight for yourself. And so those were some important lessons learned here. I just recognized that this was getting to a point where it's out of my capability in an urgent care. I could send this woman to a hematologist, but I'm not 100% convinced that this is a leukemia, and it would be weeks to months before she got in with them for a biopsy. And so that was a decision to go to the hospital at that time. I hope you guys enjoyed this episode. If you have ever seen a cerebral venous sinus thrombus in your clinic, please share that experience below. Otherwise, guys, I hope you enjoyed this video. I'm trying to keep these videos around 10 minutes or so, just quick and easy, interesting cases for you guys to see. Hope you guys enjoyed, and we'll see you in the next one.